Welcome to today's session. Today, we are going to discuss what is chronic kidney disease and what could be the symptoms and how to go about managing that particular problem. CKD, that is chronic kidney disease, is a very indolent disease. So that in the early phase, generally there are no symptoms. And that produces the problem. Many of our patients do come to the doctor only when they are symptomatic. But by the time they reach the nephrologist, many a time his kidney disease is so advanced that nothing much can be done about it. So CKD affects almost 11% of the people worldwide, and probably just a little more in India, 15.7%. So the kidney disease improving global outcomes to 2024 defined CKD as abnormalities in kidney structure or function present for 3 months and may be associated with kidney damage or albuminuria, that's albumin creatinine ratio of more than 30, and the urine sediment abnormalities, electrolyte imbalances, histological or imaging abnormalities, all are considered as part of chronic kidney disease. There could be histological changes. And so that we have got two things. One is the glomerular filtration rate, that is the GFR of less than 60, and albumin creatinine ratio of more than 30. It is divided into 5 stages and starts with 90 or higher, that is the stage 1. Then it comes down to stage 2, stage 3, stage 4. Actually, stage 3 is divided into A and B because till stage 3A, things are not that bad as far as the patient is concerned. Sometimes you can even reverse the whole thing. So, stage here, most of us, that is nephrologists, define the chronic kidney disease with some abnormality which is less than 60. So CKD can manifest in many ways once it gets advanced, and it is important to recognize these symptoms: fatigue, swelling, especially noticeable in the ankles, feet, or hands, changes in urination patterns, including alterations in the frequency or volume, presence of blood in urine, or foamy urine. Shortness of breath, nausea and vomiting, loss of appetite, muscle cramps, itchy skin, all these things are later manifestations when the patient's disease is fairly advanced. Several factors increase CKD risk, including diabetes and hypertension, a family history of kidney disease, aging, obesity, all are serious risk factors. So what do you do? Chronic kidney disease can lead to serious complications, including cardiovascular disease, anemia, bone and mineral disease, electrolyte imbalances, fluid retention, uremic symptoms, increased infection rate, and of course, sleep problems. But many a time, if you can catch them young, to a certain extent, the kidney disease can be arrested at that point or even reversed. So regular monitoring is very important check the eGFR and the albuminuria criteria for normally for all patients, more frequently for those with a higher risk, and of course, individuals in CKD 3 to 5. Control blood pressure and blood glucose levels. Use appropriate medications as prescribed by the doctor. Manage anemia and electrolyte imbalances. Treat with erythropoiesis stimulating agents, iron supplements, and dietary modifications. Address bone health. Use phosphate binders and vitamin D supplementation. Lifestyle changes like encouraging regular exercise, smoking, cessation, very, very important, and a balanced diet. So patient education provide information about chronic kidney disease management to the patient as well as the family. According to KDIGO 2024 guidelines, eGFR and albuminuria should be monitored at least monthly once CKD is diagnosed, at least twice a year if they don't have classical symptoms. And of course, those at very high risk, monitoring should occur at least 3 times annually. But why is this regular monitoring essential? Early detection of progression is very important because, as I earlier said, sometimes if it can be arrested at that point or could be reversed, and the prevention of complications and adjustments of treatment plan. Suppose it is a progressive disease, probably you may have to think about renal replacement therapy, and renal replacement therapy includes dialysis, that too hemodialysis and peritoneal dialysis, as well as the final outcome will be better with a renal transplant. So you have to have time for that. So it produces an improved quality of life and preparation for advanced stages, as I earlier said, led to plan. Lastly, regular symptom checks play a crucial role in CKD management by enabling early detection, preventing complications, optimizing treatment plans, improving quality of life, and empowering patients and preparing for them for the final care needs. Make sure to stay proactive and work closely with your healthcare and to manage chronic kidney disease effectively. Thank you very much.